Do you suffer from the debilitating symptoms of chronic pain, swelling, and loss of joint motion due to arthritis? Are you taking drugs like Celebrex and Vioxx or other super aspirin prescriptions? If you are, you're increasing the risk of heart attack and stroke by up to 50%. This is Dr. Tom Roselle, host of Dr. Tom Roselle Live Sundays at 12 noon. Why live with pain or the dangerous side effects of drugs when the doctors at the Roselle Center for Healing, practicing 21st century integrative medicine, can help you experience relief like never before? Simple, safe, chiropractic, acupuncture, and nutritional care can provide significant relief from arthritic pain in less than 6 weeks. More than 70% of our patients experience a return to life far beyond their expectations. Give yourself the best gift possible, freedom from arthritic pain, naturally. Call today to schedule an appointment. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome. You're listening to Dr. Tom Roselle Live. Guess what? We're not live in studio today, but we are live in our office. Unfortunately, we're not going to be able to take phone calls as we normally do, but we'll do the best we can. Pravash, you've had a problem. You've tried. You've applied. Guess what? This is your opportunity to find out how to fix it without drugs, without surgery. The reason we do this program is to give you the most intimate and up-to-date information on all forms of integrative health care, things that you do without having to do the invasive stuff. Well, the problem is that most of you are brainwashed into thinking that you need a drug. But let me tell you something. This is a topic that has tremendous pieces of controversy with it. And what we're going to do with it is we're going to explore the nuances, the capacity of how to fix that. And I have an amazing doctor with me, someone who has the expertise, the capacity to really give you the nitty-gritty. What are we talking about? Balancing hormones. Ladies, this topic is specifically for you. We're going to talk about what happens when you don't have your menstrual cycle, what happens when you lose one, when you go through perimenopause, menopause, all the ages from beginning to end. And to help me do that in studio, Dr. Jennifer Sims. Hi, Dr. Jen.
Hi, how are you?
Great, I'm doing well. Well, we have a blockbuster in-house continuing education program coming up on the 26th of this month, 7:30. You're going to be the host and the presenter, and this is going to be a topic that you've got tremendous amount not only interest but expertise in, and we want our listeners to know that this, as well as any in-house continuing education program, is a courtesy to anybody that'd like to attend. All we really require is a reservation. So as we go through the program today, if you would like to attend Dr. Jennifer's presentation, the 26th, all you have to do is call 703-698-7117. So, Dr. Jen, in the United States, more so, and we should say Western society, more so than anywhere else in the world, women have hormone problems. They weren't designed to be that way. How come?
Well, we know a lot of it has to do with our diet. The Western diet is so toxic anymore with the hormones that are added to the food, the quality of the food, the modification of the food. We're getting exposed to a lot of pesticides and toxins that mimic hormones. There's so many different ways that we get hormones that are not endogenous, that we're not making, that are from an outside source. So in Western society, it's becoming a real problem. Even in Eastern society, in China and other countries, they don't normally have hormone problems, but they're starting to with the introduction of our foods into their culture.
Well, I said years ago that if we ever wanted to defeat our enemies, including the Chinese at that point, all we had to do is import our fast food establishments, because that would do it over a period of time. And as you say, now it's taking place.
Absolutely. So there's lots of reasons why we have hormone imbalance, from our diet, from our stress, from our chemical exposures. Yeah, it's a lot.
What I see today is when we get them into the office all the time is we see young women, young girls coming in at age 10, 9, already starting menstrual cycles and developing the signs of women, breast tissue, expanded hips, and so forth, far earlier. There's got to be a reason that this is happening, and as you've brought out, our foods. but our hormones are being manipulated, and they're manipulated by people like Monsanto with genetically modified things. So what's the consequence? Is this just okay, or what is it predisposed to over time?
Well, the consequences are huge. Not only are we having precocious puberty, but all the emotional things that come with that, the early sexual activity that comes with that, the fertility problems that come with that as well. A lot of women who or children who are going through puberty earlier oftentimes have fertility problems as well. As they get older, they can't make babies. They have problems conceiving. All of these things matter. And then when we do have children, our children often have problems as well. So there's definitely a trickle-down effect from our diets and what we're doing in the younger, with our foods with the younger children.
How about the opposite situation? We had a patient that you and I both know about that we've been treating for a while, and here she is. She's an 18-year-old that turned 19, and she'd never had a normal menstrual cycle on her own. Matter of fact, they had to induce it medically to have her have a normal cycle. And even to the time that we started treating her at the age of 18, she was never fully menstrual, and she was underdeveloped and so forth. How does that piece happen and tie into environment? Are maybe there are not connections? Is that something completely different?
The first thing that screams to me is not enough adequate fats. I mean, we get a lot of saturated fats, but a lot of these young girls aren't getting good quality fats. They're olive oil, they're coconut oil, avocados, nuts, things that would help naturally start the menstrual cycle, not enough essential fatty acids, really severe nutrition deficiencies, vitamin E, things like that are the first thing that I would think of in that presentation. Why is this child not absorbing these nutrients to have a normal...
So fats are necessary.
Good fats are necessary, absolutely.
So we don't want them to eat potato chips and popcorn with the trans fats and all the saturated nonsense, but we've got to get a good balance of omega-3s, 6, and 9s, with, unfortunately and well known that most of our kids don't do that.
No, I mean, to be honest with you, we're not in the Mediterranean. We're not getting this great exposure to fish. We don't consume what we need to. A lot of the fish is, toxic. I mean, we can go on for hours just about that. But no, we have to actually take fats in our diet. That's why they call them essential fatty acids. We don't make them. So we have to take them from an outside source. And things that are fortified, you know how they're fortifying foods now? It's not the same quality. It's not the same level of nutrition. So these girls are not getting what they need, and they're not absorbing it. And they're not absorbing it also because of digestive problems. So it's a really complex issue. It's not just let's give her some progesterone to start her cycle.
There's an old commercial about Wonder Bread out there years ago. Wonder Bread is white bread. It's nothing more than chemistry. And they say, Wonder Bread enhanced with, 7 different vitamins. And, well, that's like giving you a $20 bill and you giving me back $4.
Right.
There's a tremendous imbalance in the situation. Dr. Jennifer Sims will be your host, your presenter at the Roselle Center for Healing in Fairfax. If you'd like to attend Dr. Jennifer's presentation Wednesday the 26th at 7:30 p.m., love to have you. Love to have you as our guest. All we require from you is a reservation. Give us a call at 703-698-7117. That's 703-698-7117. Dr. Jennifer, let's take this a little further, and let's take it up another age bracket. And, when girls start actually menstruating normally, and then there's the alteration of hormones. They're taking birth control pills, the morning after pill, all of those things, and it takes them into that next childbearing stage. What are the problems we're facing?
I was just having this conversation with a mom of a 16-year-old today. She has her on birth control pills, not for birth control, but for painful periods. And I had the conversation with her, that you're starting this so young. Basically, you're setting her up for some type of reproductive cancer along the way, because we know with the Women's Health Initiative study that was done in the early 2000s that synthetic estrogen, progesterone in the body taken for long periods of time will increase your risk for reproductive cancer. We know that. We see the commercials, right, that are 20 minutes long with all the side effects if you take this hormone. No one's talking about birth control pills. Birth controls actually have more hormone in them than hormone replacement. So we start these girls 16. They're still developing. They're still growing. They stay on it through college. They get married. They get off of it. Then they decide they don't want any more babies. They get back on it. Then they get on, HRT. And it's the cycle that their entire life they've been on some type of synthetic hormone.
Are we predisposing them to increased risk of cancers and uterine cancers and so forth?
Right, and that's the whole point, reproductive cancers. So, I've had patients go, well, I don't have, I've had hysterectomy, so it doesn't matter. And I'm like, do you have breasts? Do you have fat cells? People don't understand that hormones are not just made in your reproductive organs. They're made in every fat cell. They're made in your breast tissue. They're made in different parts of the body. The endocrine system is very complex. So it's a big issue, the hormone replacement thing. And even the weight thing, we can go to childhood obesity that we're seeing that's not being addressed properly, and we're having obese women, more fat cells, more hormones, more hormone imbalance, more issues, more fertility problems. It's this cycle. So it's a very, like I said, it's a very complex issue.
One of the things I want to talk about as we go on is obviously there's notables out there like Angelina Jolie, who had breast amputation, and she had her ovaries removed and everything else because her family had a history of cancer, and there were the BRCA markers and so forth. Second half of the show we'll touch about that, but my feeling is that it didn't matter. There's better ways of doing that, and the medical literature says that the risk of coming down with cancer with a positive BRCA marker, if you do certain things, they're going to do the same stuff anyway later on. They're going to do the surgery. But from a natural point of view, there are other ways of handling this, and I want to give women a little encouragement, and we'll talk about that as we go through. But we take this through, and we're talking about hormones, but we're talking about a whole pattern of hormones. We're talking from pituitary to thyroid to the ovaries producing hormones, and there's not one piece that is separate from the other. They're all integrated. And
that's what we'll actually draw out, and you'll see in the lecture how intimate these systems are integrated, that it actually starts in your brain. There's the hypothalamus that's talking to the anterior pituitary, and the pituitary is talking to the liver, the testes, the thyroid, the adrenals. There's a lot going on, and to just look at one part of our hormone system, estrogen progesterone balance, is missing the boat big time. You need to look at the thyroid. You need to look at that person's stress level. You need to look at their diet. You need to look at, is their liver detoxifying appropriately? It's a very complex issue, and the treatments need to be that. You can't just say, well, here's some hormone replacement or here's some birth control and you're going to be fine. It doesn't work that way.
It's not one size fits all.
No.
And so when you have a problem, we talked about the imbalance between the hormones because they are adding more estrogen. So obviously now just by that fact, your progesterone levels are going to be off. So you have an unbalanced or unopposed hormone pattern there, which is going to predispose to the cancers. But they're causing all kinds of feedback loop negative responses in the body, from shutting the thyroid down because there's an overload there. The liver is going to be involved because the liver is responsible for breaking down, or we call denaturing hormones. And so you've got so much that is taking place that they're treating symptoms, and then pretty soon the other symptom shows up. Coming up, the 26th of this month, 7:30 p.m. at our office at the Roselle Center for Healing in Fairfax, Dr. Jennifer Sims will be your presenter, your host, talking about what? Female hormones, a topic that we're discussing today. We'd love to have you as our guest. All you need to do is give us a call at 703-698-7117. Tell my staff you'd like to attend. Don't go away. We've got to take a break and pay attention to some very special advertisers who bring you Dr. Tom Roselle Live. We'll be right back.
Dr. Tom Roselle and the Roselle Center for Healing present Ageless Health 2013, 3 Keys to Wellness, Saturday, October 19th at the Fairview Park Marriott in Falls Church, Virginia. At this all-day seminar, learn how you can feel better or feel great when the doctors from the Roselle Center for Healing each discuss a topic that directly affects your health, like your food, physical fitness, preventing injury and disease, your healing process, and more. Register today at agelesshealth2013.com. That's agelesshealth2013.com.
This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We are not live in studio today, but we are live in our offices in Fairfax. One of those things that just a little bit more convenient situation for this particular presentation because I have to catch a plane and get out of town and go to Chicago. In the office with me, Dr. Jennifer Sims will be your host, your presenter this Wednesday, the 26th of the month at 7:30 p.m. Dr. Jen's going to be talking about female hormones, all those things that make you ladies go crazy sometimes, but more importantly, they can give you pain, can give you other symptoms that you wouldn't think that are associated with the imbalances of hormones. Dr. Jen, welcome back. Let's talk a little bit about those symptoms, and we have a few minutes before the break. But what are the challenges that women have? I mean, they come in and they complain of, I don't feel good, I'm tired, anxiety reactions, and so forth. All these and many more are related to hormone imbalance.
The fatigue is a big one, weight gain, an inability to lose weight, sleeplessness, not restful sleep, hot flashes, infertility, acne, dry skin, all the thyroid type of things. There's a lot, and that's why you really have to distinguish where is it coming from. Is this a thyroid problem? Are they just tired because they're not making enough thyroid hormone? Are they tired because they're legitimately tired and they've got a crying baby all night? You know, you've got to siphon all that out. But sleep deprivation does throw off your hormones. Throws off, you know, if you're not getting quality sleep, your pineal gland isn't working very well, and then that triggers a hypothalamus response, which triggers a pituitary response, which goes down that whole cascade that we're going to talk about.
Shuts down your adrenals and so forth.
So everyone really needs to be looked at as an individual, and if that doesn't get across today, I mean, that's one of the main things, and traditional medicine does not look at you as an individual. I took a course on hormones given by a male gynecologist, really nice man, and basically what he said he was taught in school was he would look at the patient's chart before he went in the room, look at the age. If they were childbearing age, he'd have birth control pills in his pockets, and if they were past childbearing age, he would have hormone replacement pills in his other pocket, and that's pretty much how he operated.
So that was it?
That was it. And he realized one day
that... So either a birth control pill or you need more estrogen.
Right. And so he said he's a very well-known in his community, worked at a major hospital, and he's like, I went to school for a long time. When did I become so stupid? He's a very educated, intellectual man, and realized that he wasn't even thinking anymore. It was just this or this. You feel into this category or this category.
Well, society has set women up for that over years because, unfortunately, women, in my opinion, since I started practice years ago, were the most put upon, suppressed patient within the medical system. Honey, it's all in your head. Mm-hmm. Are you having problems at home with your husband? All that nonsense that women came in legitimately with complaints of, I don't feel good, because their hormones, based on their exposures to the environment, the foods that they were eating, the stress patterns that they're under, and even injuries to trauma, to the brain, and so forth, stop the normal neurochemical communication.
That's a good point, too, because the other thing that he did say was he would also have the script for the antidepressant that went with it, and we know the damaging effects of antidepressants and how it's become the catch-all for everything. Antidepressants for depression, anxiety, for back pain, for sleep disorder, like it's out of control. So what he was communicating was the fact that that's how they're trained. And clearly he changed how he was practicing and doing more functional medicine and realizing that people are individuals and that's not how you treat women. But unfortunately, that is the standard of care. And I hear this every day. It's just, I went to my I asked the question, did you go to your gynecologist? Yes.
You know, it's unfortunate because that still exists in today's world.
Absolutely.
We're coming up to a break and the news. We have to listen to some very important information. My guest, Dr. Jennifer Sims. We're talking about hormone imbalances. Don't go away. This is Dr. Tom Roselle.
This is Dr. Tom Roselle Live on WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live in studio. Dr. Jennifer Sims. We're talking about female hormone problems and our in-house continuing education program. The Wednesday, the 26th, coming up this week. We'd love to have you as our guest. It starts at 7:30. All we require from you is a reservation. Give us a call at 703-698-7117. Also, we want to remind you that October the 19th, this coming fall, Ageless Health 2013 is ready to go. You can register online. Go to rosellecare.com or drtomroselle.com, drtomroselle.com. Give us a call and let us know of your interest, things that you'd like to hear about for future in-house presentations, and we'll be more than happy to do that as well for you. Dr. Jen, let's start talking about the subject at hand, women, and the unfortunate positioning that they have in the healthcare system. As I said before the break, it's been my experience over the years that women have been the downtrodden in the medical system because their problems either haven't been taken seriously or they've been drugged to death where they have no way of reversing themselves. They've been put on thyroid medication that overdoses and shuts the thyroid down. They've been put on hormone that increases the risk of certain types of cancers. How do we stop all this? How do we break the pattern?
Well, we start asking better questions, getting more educated, seeking out doctors that look at functional medicine and look at you as a complete person, not just as your symptom. Symptom-based medicine is got to go. We have to look at functional medicine. We have to look at where the problem is, what's going on in this particular person's life. And people need to start looking for physicians that support that. And there are medical physicians that are getting it. But we deal with this on a daily basis in our practice. We deal with the nutritional components, the structural components, the emotional components of all of it. And I encourage people to start reading more and getting more educated. Ask questions. Don't just take the standard hormones and antidepressants and think that's going to fix your problem, because I'm here to tell you it's not.
The sad thing is that there's so many women out there today that know more about what's going on with their bodies than their physicians do.
Absolutely.
They get it. They understand it. They realize that they have to be the master of their own ship because nobody else is going to do it for them. But let's kind of talk about what comes first, the chicken or the egg. And this is something that I see with women all the time when we treat them in the practice. They come in, they have a thyroid problem. Mm-hmm. Invariably, if they have a thyroid problem, they have hormone imbalances across the board. So we do something called an adrenal stress index. We do some other salivary hormone testing because it's the first available hormone in the body. And so what you see is you see adrenal function problems. You see the thyroid hormone being skewed one way or the other. But the one place that I check all the time, and here's the chicken and the egg problem, is I see liver function problems. So when we see a woman in her late 30s, 40s, getting ready to go through menopause, is it the predisposition to all kinds of other hormones, or is it because that the liver's been screwed up for so many years because of its demand of having to detoxify the body and filter the system, and now because it denatures the hormones, now we have all these other things going on? I know it's a long, circuitous thing, but,
Well, that's a tough question. I don't know if it's the chicken or the egg thing. Also, the liver is where hormones are made. Hormones are made, they're components of cholesterol, and that's where our liver is made. So it's made and manufactured, and we have to break it down there. So there can be disconnects along the whole chain. If I had to pick one, I would lean towards the liver most of the time, between poor choices as probably teens, experimenting with things we shouldn't do, drinking too much, smoking, different things that we're eating will definitely affect the liver function. But once again, too, we've got to go back to the brain and the hypothalamus and the pineal and the pituitary. And if they're not talking well to the liver and the adrenals and the thyroid, so there's a lot of ways to look at it, and you really need to find someone who can look at all of those aspects of it, not just staring at your ovaries.
So how do you evaluate? You get a patient that's in front of you, and we know that the pituitary gland is going to put out and secrete different hormones: thyroid stimulating hormone, luteinizing hormone, we call LH, follicle stimulating hormone. And how do we know that there's a functional incapacity of that communication system? And there's a couple of things there, because we can get into the inability for that brain to communicate, or we can get into the receptor site incompatibility. You know, we talk about insulin resistant, but there are other targets that are resistant too, and here we're talking about hormones.
Well, first we go by history, and then based on that we do run tests. We do a full thyroid. We check through the blood. We do adrenal testing. The adrenal testing is really valuable because it's going to tell us if the adrenals are the only problem, if there's a hypothalamus problem, if there's a pituitary problem. We use, like you said, a lot of saliva testing for that. We also test the hormones. We test the estrogen, progesterone, testosterone, luteinizing hormone all through saliva. It's much more clinically accurate to do it that way. And we give appropriate treatments based on the testing that we find.
So if you find a significant loss of thyroid stimulating hormone, okay, let's take the thyroid for example. Most physicians, when they order blood tests, they're going to order TSH and they're going to order T4, and that's all they order.
Right.
If they're lucky, sometimes just TSH. There's other components that are necessary. How does that all relate to women hormone balance and the way things should be?
Well, you have to look at the whole gland, the whole organ. When we're doing just TSH and T4, we're looking at a fraction. We're not looking at the conversion of T4, T3. We're not looking how the adrenals are affected by reverse T3. We're also not looking for autoimmune diseases. I cannot tell you how many young women I have found have Hashimoto's disease.
Very common, far too common.
It is crazy common, and it's a blood test. It's easy. It's covered by insurance. It's invaluable information, and it needs to be checked. So when I say we do blood tests, we do not do just the traditional TSH and T4. We look at all of the components of the thyroid.
You know, to show how common some of the functional medicine community thinks that Hashimoto's thyroiditis is becoming, they're saying that somebody comes in with a thyroid problem presentation that you suspect clinically, that about 40 to 45% of those people are Hashimoto's patients.
I believe that.
That's huge.
Because the more I'm running, the more I'm finding it, and it's not like the values aren't slightly elevated. They're 10, 20, 30 times elevated, and you're going, that's why you feel so tired. This is why you're not feeling well, or this is why your thyroid medication isn't working. They keep giving you more and more Synthroid, and this is an autoimmune problem. We need to support the immune system. Increasing your Synthroid is not going to fix this. So yeah, I mean, we have to look at the whole picture, and it's not happening.
Well, people feel, if not better, sometimes worse by giving them T4. And then they give them Armour, which is we encourage people, they have to take thyroid medication, that you want a natural hormone like Naturoid or Armour Thyroid. The problem with that, if it's a Hashimoto's thyroiditis, it actually can make things worse.
Right.
In studio, Dr. Jennifer Sims, your host this Wednesday at 7:30 p.m. at the Roselle Center for Healing. It's the 26th of the month. We'd love to have you as our guest. If you're in any consideration whatsoever that you may have a hormone imbalance, whether it's thyroid, whether it's estrogen, progesterone imbalances, where the problems came from, whether you're young or you're later on. This is one of these things that you really need to pay attention to, and this is an amazing lecture that you will walk away with how to fix it. Give us a call, 703-698-7117. That's 703-698-7117. Tell my staff that you'd like to attend Dr. Jennifer Sims' presentation this Wednesday, the 26th. Let's talk a little bit more about that missing link, so to speak, that problem with the thyroid, because I want to take it all the way back down to the hormone level. And so you said T4 and TSH is not enough, because T4 has to be converted, and it has to be converted back to our old friend, the liver. Mm-hmm. And if the liver is toxic, not working, it can't convert it to the active hormone, which is T3. But then we may have an inflammatory pathway problem that's blocking reception, and that's where we get into our Hashimoto's thyroiditis and things of that nature. So when you're looking at these types of things, we know they can be fixed, but there's exposures all around us that cause that hormone not to work properly, and we're also extrapolating that now to estrogens. One of the things that I've listened to, and I want your opinion on it, is the thing about halides, bromides particularly. Bromides compete in cell tissue for thyroid hormone. And if they can't get in, unfortunately, bromides today are all over the place, from smelling of odors in the car to the things that they're spraying on our vegetables. Those are all halides, and they're destructive. How do you see that matching up with a lot of these kids that are coming in?
Well, it's clogging up the liver for sure, if anything, which is going to throw off the whole process as well. With kids, I mean, that's a whole nother topic.
Yeah, it is a whole nother topic.
As far as...
But it's part of the puzzle.
Sure, as far as detoxification, mental processing, hormonal changes, all of this is affecting us. And we haven't even touched, how I feel about genetically modified foods and adding insecticides and pesticides into this mix. These are things that we don't know what it's going to do to our DNA. We know that our body is just trying really hard to process it and detoxify it, but long term, we don't even know the can of worms. I mean, we see just from our short time period how with pesticides and insecticides, how fish have changed, right?
That's
how
right.
Fish have become male fish have become more female fish. And that's just in the fish. And what's getting dumped into the waters. We don't know all the effects these toxins are going to affect years out, and our kids and babies and all that kind of stuff.
Well, we know that is affecting men in this society, in this generation, significantly. A man today who is in their early 30s has the sperm count of a guy who was in his 60s in the 1950s. I mean, there's something wrong about that, and we ignore that. Guys are having a more difficult time getting pregnant with their wives. Mm-hmm. It's more of a challenge, and it's because of our exposures. But this effect with women is also exponential. You have cystic formations, you have receptor site incompatibilities, and then all the other things that come around, the osteoporosis, the pain, the heart problems, the mental acuity situations, and to go back to the things that we were talking about. But this is environmental, and I know you see these things all day long. So a woman comes in and she says, Dr. Jen, I'm going through a horrible, horrible transition. And all transitions, whether it's from a young child to a woman or from a woman who's now going into menopause, should be easy. Why are we having the problems? Let's take menopause, for example. These women come in and they have the hot flashes, the night sweats, and all of that. Horrible stuff.
We have to take a history. How long have they been on birth control pills? What's their diet like? What's their stress like? What's been going on with them up until this point that they're having the hot flashes? Because not everybody has hot flashes who goes through menopause. Not everybody who goes through menopause has symptoms. We have just been conditioned to believe that's normal, so then we can now medicate. But there are some women who don't have these issues.
The drug companies have to make money, Dr.
Absolutely.
Jen. I mean, if you fix
they
this
need
stuff,
us
you're going to deny it.
HRT and Boniva because Sally Field takes it, it's just ridiculous.
And now they have the injectable forms, take it once a year. And what women don't realize when it comes to an osteoporosis type of condition, we could talk about this all day long, is that it hardens the bones like a dead stick. And most fractures occur horizontally, not vertically. And so, it makes it stronger to set things on top of, but as soon as you pivot, you're going to break a hip.
That's how people usually hurt themselves, pivoting, stepping off of a curb.
So anyways, as we go through and we try to show women how to do this, there's an actual very specific pathway that's brought this about. Coming up for a break, and when we come back, we're going to have a lot of information for you, very specific data, and also invite you again this Wednesday evening, the 26th of the month, 7:30 p.m., join Dr. Jen. We'll be right back. Don't go away. This is Dr. Tom Roselle.
If you're looking for the best in natural health, wellness, and green living products, shop the Roselle web store on Amazon.com. You'll find a variety of products and resources that are designed to help achieve an ultimate state of health and wellness. Shop the Roselle web store on Amazon.com today. Visit drtomroselle.com and click on Roselle web store. That's drtomroselle.com and click on Roselle web store.
Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series video on demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
Dr. Tom Roselle and the Roselle Center for Healing present Ageless Health 2013, 3 Keys to Wellness, Saturday, October 19th at the Fairview Park Marriott in Falls Church, Virginia. At this all-day seminar, learn how you can feel better or feel great when the doctors from the Roselle Center for Healing each discuss a topic that directly affects your health, like your food, physical fitness, preventing injury and disease, your healing process, and more. Register today at agelesshealth2013.com. That's agelesshealth2013.com.
Dr. Tom Roselle Live continues now on WMAL.
Welcome back. This is Dr. Tom Roselle. You've been listening to Dr. Tom Roselle Live. We have been not in studio today, but in our office broadcasting a very special program. My guest is Dr. Jennifer Sims, who will be your host, your presenter this Wednesday, the 26th of the month, 7:30 p.m. at the Roselle Center for Healing. Love to have you as our guest. All you need to do is call 703-698-7117. Dr. Jen, let's kind of wrap this up for everybody and kind of talk about why they should even come and who should come.
Well, why they should come, because people should get educated about their bodies, what's normal, what's not normal, your options for hormone balance, and anybody should come, anybody who's got, preferably female, but even spouses if they're trying to support their females.
And they want to help their wives.
Yeah, if they want to help their wives.
Others.
Absolutely. Because I think it's important to understand, like I said, your options and what's going on with your body.
Let me ask you a question. Can anybody fix their hormone problems?
With the exception of a few crazy things, for the most part, we can balance them, yeah.
And you can do it without drugs, without surgery?
Yeah.
Okay, so let's talk about what a woman says, I've had a total hysterectomy. Mm-hmm. How do you handle that?
Well, it depends if they're having symptoms or not. If they're fine with it, you can still support the other hormone-producing sites in their body. You can still teach them how to eat to support their bodies. It's the same person. Their body's altered a bit, but it's still the same person.
It's an unfortunate thing that people don't understand that even ovaries have a function after menopause. The uterus has a function after menopause. They still produce hormone. It's not like they've stopped completely. In other societies, they transition gently. And the only thing that should stop at menopause is no more hormone. When young women become menstrual and they go into childbearing age, it should be an easy transition, and they should go into an ovulatory cycle that is normal. Unfortunately, as we talked about, because of environment, because of stress, because of injury patterns to different parts of the body, those things don't happen. And I know you're going to cover that in depth this Wednesday evening. So if you'd like to join us, and we'd love to have you, 703-698-7117. That's 703-698-7117. Tell my staff that you'd like to attend Dr. Jennifer Sims' presentation on female hormones. If you'd like to see other upcoming events, go to Roselle Center. And how you find that is www.rosellecare.com, or go to drtomroselle.com, and you will find all our upcoming events. And the one that I really want you to pay attention to is October the 19th. What's that? Ageless Health 2013. This will be a day that you will not long forget. It's one that will give you the tools, the capacity to turn your life around. Register today and save some money, because if you wait too long, one, it's going to be filled, and you won't be able to get in to see us. We're here every Sunday, 12 p.m., bringing you the most intimate and up-to-date information on integrative and alternative health care. We try to serve you every way that we possibly can. And remember, do your own homework. Don't believe anybody. Your health is in your hands. This is Dr. Tom Roselle. See you next week. Bye.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
Thank you.